Does she even know how to pass that medication? Okay, new grad. Gosh, she takes forever to chart. I mean, why was she even hired here if she can't do her job? Yeah, what do you want? Okay, yeah, whatever. I mean, you're supposed to know what you're doing. Yeah, you are off orientation, so why are you still asking me questions? She'll figure it out for herself. She doesn't need my help. Go make the new girl do it. I mean, gosh, I've been here for over 2 years. Why should I be doing that? All nurses eat their young, right? So why is this any different? All right, everyone, welcome back to my channel, Nurse Katherine here. Today's video is something that weighs heavy on my heart. Obviously, I love to educate and I love working with new grads, and I always have. But I have heard some horror stories from new grads and new nurses, student nurses about their first job, and even years into their job about nurse bullying. So I am here to talk about that today, and I really want to ask you the question, are you perpetuating the nurse bullying culture? I'm really hoping that this video can open a dialogue in the comment section below. If you are commenting below, please be very respectful what you are posting and what stories you are sharing, and please share them in a kind way. I don't want any drama going on down in the comment section or any more nurse bullying going on in the comment section. So please be mindful of that if you are sharing your story of nurse bullying. So before we get started, do not forget to hit that subscribe button right now and give this video a big thumbs up. But other than that, let's get this video started. Now I posed the question, are you perpetuating nurse bullying? And before I get even further into this video, I do want to say to my more seasoned nurses, just because you were bullied when you were a new grad or when you were a new employee does not make it right for you to do the same to somebody you are training. So I want you, meaning the nurse watching this, the student nurse watching this, the OR nurse watching this, the trauma nurse watching this, the infusion center nurse watching this, the nurse practitioner watching this video, to think back over your interactions throughout all your years of nursing or of schooling, and think about a time where maybe you have gossiped or slandered somebody's name or talked down upon to somebody, and so on and so on. Nurse bullying is defined as horizontal violence in the workplace, or also known as lateral violence in the workplace. So horizontal violence is defined as any hostile, aggressive, and harmful behaviors by a nurse or a group of nurses towards a coworker or a group of nurses via attitudes, actions, words, and or other behaviors. Behaviors associated with horizontal violence contribute to an unsafe work environment and poor patient outcomes. So I want you to think on that. Think about what I just defined horizontal violence as. Is that something that you contributed to? Is that something that you're trying to not contribute to? Is that something you're looking at and you're seeing but not doing anything about? So think about these things as I go through the rest of this video. Now, I want to share a really great story from a seasoned nurse. This is not a new nurse, and talking about their workplace bullying that went on with them. So this story is from an article also linked in the description below, so you can read it there as well, but I'm going to read you a piece of this article. So the story goes, when I first started as an experienced nurse, but new to the current hospital, more senior nurses would call me names and question my abilities in front of patients. She was quick to note, meaning this nurse, that she actually had more experience than these senior nurses, but was still considered a newbie. She goes on to say, I spoke to my manager several times as well as the director of the ICU because there was a very clear hospital policy against nurse bullying. Ultimately, nothing was done, and I was given the choice to deal with it or transfer to another unit. The story ends as, after much consideration, this nurse says she decided to stay on her unit and worked hard to be a positive role model for other staff members. While the changes on her unit will take time and may be very small and incremental, she is optimistic that the culture can change. So for my new grads out there watching this video, know that you may see this culture in nursing. You might not have seen it in nursing school, but you might now see it as a new grad. And for those of you who are not new grads and finding a different position, this still might happen to you. New grads, this does not only happen to you. This also happens to more seasoned nurses as well. So I want you to remember that story that I just read about that ICU nurse. I can relate to that ICU nurse very well. I have encountered nurse bullying myself, but I also was very optimistic, and my outlook on my unit I thought could change, and it did. And it was absolutely amazing seeing the culture of the one unit I worked on change over time. So again, I'm here to ask you, are you perpetuating nurse bullying? Or are you seeing it and just not doing anything about it? Did you even realize you were being bullied? Did you even realize you were actually bullying somebody else? And lastly, before I finish this video, please comment your stories in the description below. Please make sure they are thoughtful about who you are talking about. I don't want any gossiping, but stories help other nurses and new grads get through their own personal journeys, honestly. It is so helpful to hear a story and see what the outcome was, good or bad, and learning aspects of that and what we can learn from those stories. So if you have ever encountered nurse bullying, if you were a nurse bully, please comment below, and I would love to hear your story, but just please make sure you are very respectful when you are commenting below. All right, but that does it for today's video, everyone. Thank you for tuning in, and thank you for listening all about nurse bullying today. But other than that, that is it. Make sure you are subscribed and like this video, but I will see you in Saturday's video, and have a good rest of your night.